Your lungs, essential for breathing, vital for life. But what happens when these crucial organs face a chronic challenge? This is chronic obstructive pulmonary disease, or COPD, a progressive condition that makes it harder to breathe over time. At its core, COPD is an umbrella term for two major conditions: chronic bronchitis, inflammation of the airways causing persistent mucus and coughing; emphysema, damage to the air sacs reducing oxygen exchange. Together, these conditions make it difficult to move the air in and out of your lungs, leaving you shortness of breath. The number one cause of COPD is smoking. Tobacco smoke irritates and inflames the airways, causing lasting damage. Even exposure to secondhand smoke can increase your risk. Polluted air is another major risk factor. Long-term exposure to outdoor pollutions like smog and industrial fumes can harm your lungs. And it's not just outside. Indoor pollution from cooking with biomass fuels like wood or coal is a significant risk factor, especially in developing regions. Certain jobs can also increase your risk. Working in industries with high exposure to dust, chemical vapors, or fumes put added strain on your lungs. Sometimes COPD runs in families. A rare genetic condition called Alpha-1 Antitrypsin Deficiency makes your lungs more vulnerable to the damage, even without other risk factors. Frequent respiratory infections during childhood can lead to reduced lung development, increasing the likelihood of COPD in later life. Age is another factor. As we grow older, our lungs naturally lose strength and elasticity, making them more susceptible to COPD. One of the earliest and most common symptoms of COPD is chronic cough. This cough may linger for months, often producing mucus, especially in the mornings. Shortness of breath or dyspnea is another hallmark symptom. At first, it may only occur during physical activity, but as COPD progresses, even simple tasks can leave you gasping for air. This happens because COPD narrows the airways, making it harder to move the air in and out. Wheezing, a whistling sound when you breathe, is caused by airflow passing through narrowed airways. Many people with COPD describe a feeling of tightness or heaviness in their chests. This can make breathing feel like an uphill battle. As your body works harder to breathe, less energy is available for other activities. This leads to fatigue and overall feeling of weakness. People with COPD are also more prone to frequent respiratory infections, like cold, bronchitis, and pneumonia. These can worsen symptoms and lead to dangerous flare-ups. In severe cases, symptoms can suddenly worsen in what's known as an exacerbation. This may include extreme shortness of breath, rapid heart rate, and increased mucus production. Diagnosing COPD typically involves a simple breathing test called spirometry. Early detection can make a big difference. While there is no cure, treatments like bronchodilators, steroids, and oxygen therapy can improve quality of life. Regular exercise and quitting smoking are also vital steps. Prevention starts with avoiding risk factors. Protect your lungs by avoiding smoking, wearing masks in polluted environments, and getting vaccinated against respiratory infections. Living with COPD can be challenging, but with the right support and care, individuals can still lead fulfilling lives.